Hi, I'm Mark from OnePagePractice, and today we are going to discover a little bit more about the extraordinary power of checklists. So what can a checklist do? Well, a checklist can improve performance, which in turn improves patient safety, and that in turn can save lives. Seems a pretty tall order for the simple checklist, so I'm going to illustrate this with an example. And this example is really a pivotal example in medicine. The ideas from this study were developed by an intensive care doctor in North America called Peter Pronovost, and he decided he'd had enough of central line infections. He'd seen many people stay longer in intensive care than they needed, and he'd even seen people die as a consequence of it. So he decided that he was going to make a simple checklist which would identify the key processes to reduce infection from central lines. And he came up with a 5-point list. And when you read down this list, you'll realize that these are really simple things. These are steps we take for granted. We might even expect our medical students to be able to discuss these at the bedside. It's important to note that there aren't any technical details here. There's nothing about which approach is best. There's no anatomical landmarks. There's nothing about the technology we need to use or the equipment. Really simple things that we need to do every single time to try to reduce central line infections. Once he developed this list, he decided he was simply going to observe for a month. So he gave the list to his nurses and he asked them to record how many of these steps were performed when the medics were putting in a central line. This is what he found. He found at least one step was missed in more than a third of cases. So isn't that incredible? Simple things that we take for granted were missed by really experienced clinicians. These people are registrars, consultants with many years of clinical experience, and yet in more than a third of cases they missed at least one step. So what he did next was he discussed this with the management, and they decided that they were going to allow nursing staff to observe every procedure and work through that list, ticking off each step as it was performed, and they were given the mandate that they could gently remind the clinician if they missed a step and that they needed to complete that step before moving on to the next. So they did that, and they followed it up for a year, and the results were so astonishing that they followed up for another 15 months because they couldn't quite believe what they found. And this is what they found. They found that the 10-day infection rate fell from 11% to 0. That's right, 0. Simply by using a 5-step checklist, they essentially eradicated central line infection in the intensive care unit. And they calculated that over their 2+ years of study, in their single hospital, they prevented 43 central line infections, they saved 8 deaths, and they saved over $2 million in costs, largely down to reduced length of stay in the intensive care unit. That's how powerful a checklist is. A checklist can save lives. And as I say, this was really the first time that a checklist was proven in a well-designed, robust, evidence-based manner to save lives in medicine. So having shown you the power of checklists, we're going to talk a little bit about how they work. And they work in a really simple way. A well-designed checklist just sets out the minimum number of key steps in a process. And that's exactly what happened in this case. He identified 5 key steps to reduce infection, and then using that checklist allowed all the clinicians to improve their memory and attention. So if they had a really long day and they were tired, using that checklist meant they would never miss a step. And by doing that, it reduces slips and mistakes. And we'll talk a little bit more about this in another webcast, so don't worry too much about the terminology. In turn, reducing slips and mistakes is what allows checklists to improve performance, go on to improve safety, and in turn save lives. So that's how the humble checklist can have such an incredible impact. There's a couple of other key features about checklists, and the first is that checklists improve performance without a change in skill level. It means that you can start using a checklist today without any additional training, and it will improve your performance, improve the care you give your patients. when we look back at this example, the guys who were putting in central lines didn't go on a training course or do any extra reading. They just started using a checklist. And by doing so, they improved their performance to the point where they saved lives every year. That is how extraordinarily powerful a checklist is. And another key feature of this is that checklists are a transferable concept. And since this pivotal study in medicine, many people have gone on to use the idea of a checklist. Indeed, the most famous example is the now called World Health Organization Surgical Safety Checklist. And this was an idea developed by a neurosurgeon in North America called Atul Gawande. And he developed a 19-point checklist to be used before anesthesia, before surgery, and after surgery to try to reduce morbidity and mortality. And the study he performed occurred in 8 centers in both developed and developing countries. And they found, after a period of follow-up, that using that 19-point checklist significantly reduced morbidity and mortality. They estimated that if it was used worldwide, millions of lives would be saved every year. It was deemed such a powerful concept that it was embraced by a huge number of organizations. Indeed, the World Health Organization overtook the idea, hence why it's called the World Health Organization Surgical Safety Checklist. It's now routinely used in every NHS hospital in the United Kingdom, and it's used across many developed countries. If you want to know a little bit more about that study, just Google World Health Organization Surgical Safety Checklist. If you want to read a little more about the revolution that's happening in checklists, I urge you to pick up the New York bestseller, The Checklist Manifesto, written by Atul Gawande, who developed the concept. It's a beautifully written anecdotal book which explores the role of checklists in healthcare, how it can help doctors and nurses respond to things from flu epidemics to drowning. But more importantly, it looks beyond medicine and looks how checklists are impacting the world in aviation, banking, construction, all sorts of businesses. I found it changed the way I thought about the world, and if you have a little bit of spare time and are looking for something interesting and easy to read, I urge you to pick up a copy. And finally, on the concept of transferable ideas, if you want a little bit more information, please head on over to OnePagePractice.com, where we've taken the idea of a checklist and we've built it into a one-page consultation for general practice. We're just starting out. We'd love to hear what you think of it. We'd love to hear how we could improve it. If you want to get in touch with us, please do so through the website. Thank you very much for listening. Bye for now.